Welcome to the Citadel Patient Care System demonstration video. This guide is designed to provide users with an overview of the Citadel Patient Care System, as well as some guidelines on its correct use. In each of the sections that follow, you'll be guided through the key features and functions of the Citadel Patient Care System. For more information on a specific feature or procedure, you can choose to navigate directly to the most relevant section by clicking on the appropriate title in the Contents menu. Always read the Instructions for Use manual before using the product. Product Overview. The Citadel Patient Care System, part of the ARJO Huntley Universal Medical Bed Platform, is the combination of the Citadel Bed Frame System and the Citadel Patient Therapy System. The Citadel Bed Frame System is designed to aid staff in the performance of routine medical care and is indicated for the management of patients in critical care, acute care, and medicalised long-term care. The Citadel Patient Therapy System provides an optional, fully integrated multimodal therapeutic support surface for effective pressure redistribution. It is indicated for use in the acute and post-acute care environments, and in combination with the Citadel Bed Frame System, it is indicated for the prevention and treatment of pressure injuries to treat burns and aid circulation. The Citadel Bed Frame System also includes an integral power connector for the Skin IQ Negative Airflow Microclimate Management family of products, which can also aid in the prevention and treatment of skin breakdown and pressure injuries stages 1 to 4. The Citadel Patient Care System is 252 compliant with a safe working load of 270 kilograms and is suitable for use with patients weighing between 40 kilograms and 227 kilograms, who are between 1.46 m and 1.90 m in height. Side rail controls. This section provides an overview of the Citadel Patient Care System controls found on the safety side rails, which have easy-to-understand buttons with symbols common to all universal medical bed platform products. Caregiver controls are located on the outer side, while patient controls are on the inside of the upper side rail. Please ensure that the proper clinical and ergonomic working techniques are utilised at all times to avoid injury. For further details, please refer to the Instructions for Use manual. Upper side rail controls. Up and down buttons. Use the up and down buttons to raise and lower the bed. The bed deck can be adjusted to accommodate different caregiver heights and care procedures, as well as patient safety. An optional foot control can also be utilised to raise or lower the bed. This is helpful for bed height adjustment when the caregiver has both hands occupied. To utilise the bed foot control, lift the foot control cover with your foot and press the left side of the pedal to raise the bed and the right side to lower the bed. One-button cardiac chair. The upper side rail also contains the one-button cardiac chair feature. Patients can benefit from the cardiac chair position, as lowering the legs may help improve comfort by reducing pressure on the abdomen, whilst a more upright position can help respiratory mechanics. Situated directly underneath the cardiac chair button is a bed deck reset button, which will flatten the bed from any articulated position. (360-degree anti-entrapment sensors). Another standard safety feature are the 360-degree anti-entrapment sensors, which prevent the bed from lowering if anything crosses the infrared beam surrounding the lower bed frame. This can be very helpful to protect caregivers, cleaning or service staff who may be working on the lower part of the bed in the event of someone else activating the bed down controls. Underbed light. If the patient is able to exit the bed without assistance, the underbed light can be activated at night to illuminate the floor close to the bed frame to help assist patient orientation when exiting the bed. Patient control panel. The patient control panel is on the inside of the upper side rails. It can be used by the patient or caregiver to raise and lower the backrest or thigh section of the bed. Depending on options chosen, it can be used for nurse call communication and controlling the patient environment, such as room lights or television. Lower side rail controls. Status indicators. At the top is the System On LED indicator, which is illuminated when the bed is powered and functional. In the middle is the backup battery charge level indicator, and at the bottom we can see the anti-entrapment system indicator. Patient positioning, up and down buttons. The up and down buttons are repeated on the lower side rail to raise and lower the bed deck height. As a safety feature, the bed will pause at 38 or 40 centimeters above the floor, depending on the size of the caster, before continuing to its lowest height. Patient positioning, backrest angle button. The backrest angle button raises or lowers the head of the bed. The degrees achieved are displayed on the digital screen for accurate patient positioning. When raising the backrest, it automatically pauses at 30 degrees. This helps caregivers when positioning patients for improved ventilation, for example. Press the button again to continue the upwards movement if required. Patient positioning, thigh and calf sections. Up and down buttons are available for raising and lowering the thigh and calf sections. They can be used to position the patient comfortably or to improve pressure redistribution in vulnerable areas of the body, such as the sacrum and heels. They also help prevent unintended patient movement up or down the bed when using Trendelenburg and reverse Trendelenburg. Patient positioning, Trendelenburg and reverse Trendelenburg. The Trendelenburg and reverse Trendelenburg buttons enable tilting of the head or foot end of the bed, with a hard stop at 0 degrees in both directions. The angle of the bed is visible on the digital screen. Patient positioning, one-touch automatic CPR feature. The button with the heart-shaped icon activates the automatic CPR feature. When continually pressed, it will rapidly flatten the backrest, thigh and calf section while lowering the bed simultaneously. After a short time, it will also trigger rapid deflation of the integrated surface if used. Patient positioning, button lockout function. All of the buttons, except the CPR button, can be locked out by pressing the padlock button and then pressing each button that you wish to lock in turn. An illuminated LED indicator will identify which features are locked. To reverse this function, simply press the padlock again, followed by the illuminated features you wish to unlock. Built-in digital weighing scale. The built-in digital weighing scale should be set to 0 before the patient is placed on the surface. Depending on your country, you may have the option of toggling between pounds or kilograms. You may also be able to toggle between the display showing the patient weight to the nearest 100 or 500 grams. Please refer to the Instructions for Use manual for further details. With the patient on the bed, Capture their weight by selecting the first button featuring the patient on the scale. The result should be visible on the display screen. Following the weighing process, the patient's weight can be displayed for 10 seconds whenever this button is pressed. The Auto Compensate function allows you to add or remove equipment, such as an IV pole or monitor, without affecting the patient's initial weight reading. Press the button to activate the function, then add or remove equipment. Then press the button again to turn off the Auto Compensate function. VeryZone Movement Detection System. Simple push-button controls are provided to enable or disable the bed exit alarm and detect for undesired movement of the patient. Once activated, use both the left and right buttons to adjust the sensitivity. The sensitivity indicator is situated between both buttons. The system has a mute button which will silence the alarm for 3 minutes once pressed. Sensitivity of the VeryZone movement detection system can be adjusted to detect less or more movement depending upon requirements, and trigger an audible alarm to alert medical staff. At the least sensitive setting, VeryZone can be used to measure major movements, such as a patient exiting the bed. At its most sensitive setting, it can be used to measure minor movements, for example, in patients in intensive care units who may have been sedated. Integrated Support Surfaces Caregiver Control Panel. This section provides an overview of the Citadel Integrated Support Surfaces Caregiver Control Panel. If an integrated support surface like the C100 or C200 is being used, a control unit will be attached at the foot end of the bed frame. The Caregiver Control Panel is on the upper surface of the control unit. Please ensure that the proper clinical and ergonomic working techniques are utilised at all times to avoid injury. For further details, please refer to the Instructions for Use manual. Control unit buttons, indicators and alarms. The control unit power button is used to activate the integrated surface functions. The lockout button locks all the controls to avoid accidental or unwarranted adjustments when in use. The panel integrates 3 safety alert indicators. The side rail indicator is to alert and indicate which side rails are down. A head of bed angle indicator to ensure the backrest is at 30 degrees or above. An alarm indicator lights up if any alarm conditions exist. It will extinguish when the alarm condition is cleared, or the alarm mute or clear button is pressed. It is possible to mute the alarm for 10 minutes during an alarm condition. Nurse care settings. Press the seat deflate button to either activate or deactivate this function. An audible tone will sound to indicate when pressure in the seat has dropped by 50%. It will also periodically sound as a reminder once activated. Press the head deflate button to either activate or deactivate this function. An audible tone will sound to indicate when pressure in the head section has dropped by 50%. It will also periodically sound as a reminder once activated. Press the firm support surface button to fill all cells and quickly provide a firm support surface for nursing procedures or patient transfer. An audible tone will sound to say when the operation is complete. It will also periodically sound as a reminder once activated. If it is not deactivated after 30 minutes, the system will automatically return to previous settings. Press the transport button to continue to support the patient when mains or battery power is not available. Pressing the transport button before unplugging the mains will inflate the surface slightly above the preset pressures and then maintain the surface inflated during transportation. An audible tone will sound to say when the function is complete. It will also periodically sound as a reminder once activated. Therapy settings. Toggle through the patient presets. These are determined by the weight and height to set the appropriate default support pressure setting for the patient. As every patient is unique, you can apply targeted pressure redistribution in up to 4 separate zones using the manual pressure adjustment buttons. To use the manual pressure adjustments, simply toggle up and down in one of the 4 zones to increase or decrease cell pressure in the head, thorax, sacral, and leg sections. Turn Assist feature. The manual Turn Assist feature is used to support patient care and repositioning. Press the button once to turn and hold the patient to approximately 20 degrees to their left or right as required. Press the horizontal center button to reset the support surface to its flat position. For safety, the side rails the patient is being turned to must be up for this function to be activated. If a side rail is taken down, if the head of the bed is moved to above 30 degrees, or if active pressure is being selected, an alert will sound and the support surface will return to a horizontal flat position. An audible tone will sound to say when the operation is complete. Continuous Patient Turn and Hold feature. The Continuous Patient Turn and Hold feature allows clinicians to set continuous rotation from left to centre to right and back. The timer icons indicate the duration of the pause in each position. Press the button to toggle through the various timer settings. All the safety side rails must be up for the rotations to begin. Alternating pressure and pulsation. To set alternating pressure and pulsation, toggle through the different modalities, starting with therapy on and moving up to low pulsation, medium pulsation, high pulsation, and alternating pressure, all of which alternate in a 1-in-2 cycle. Pressing the clock button will toggle through the timer settings for pulsation or alternating therapy cycle times. The default cycle for alternating therapy is 10 minutes. Other frame features. This section provides an overview of Citadel bed frame system features. Please ensure that the proper clinical and ergonomic working techniques are utilised at all times to avoid injury. For further details, please refer to the Instructions for Use manual. Auxiliary power outlet. The bed has an integrated auxiliary power outlet, which can be used for plugging in DVT pumps or any other non-critical medical devices. Skin IQ plug. A convenient plug is available for the compatible Skin IQ microclimate management system. When using battery power, it will support up to 4 hours of microclimate management. Bed and mattress extension. The Citadel bed frame and integrated C100 and C200 support surfaces can be extended to accommodate tall patients up to 2 meters 15. To adjust the frame, simply press the lever which is situated under the bed deck below the patient's left foot and slide out the bed extension. Optional Safe Set Visual Alert System. The optional Safe Set Visual Alert System will identify when the bed is in its safest position, with the bed height set at its lowest, all side rails up, brakes deployed, and VeryZone activated. integrated C100 and C200 support surface and microclimate management. This section provides an overview of the integrated support surfaces and microclimate management for Citadel. Please ensure that the proper clinical and ergonomic working techniques are utilised at all times to avoid injury. For further details, please refer to the Instructions for Use manual. X-ray sleeve. As well as providing advanced and targeted pressure redistribution for each patient, the integrated C100 or C200 support surfaces include a large X-ray sleeve, which is conveniently integrated into the top cover of the support surface and positioned behind the thorax. It is accessed from both sides for easy insertion of a cassette without any contact with the patient's skin. Expandable foot end. The integrated C100 and C200 support surfaces can expand one cell diameter to accommodate tall patients up to 2 meters 15 or 84.6 inches. Once the bed frame has been extended, extend the support surface by connecting the 2 white connector valves under the corner flap by the patient's right foot. Skin IQ Advanced Microclimate Management System. The Skin IQ Microclimate Manager is a vapor-permeable cover that can be used with the Citadel integrated support surfaces to minimise risk factors that can be associated with the development of pressure injuries. By using proprietary negative airflow technology, Skin IQ will draw the moisture vapour and heat away from the skin or surface interface to reduce shear, friction, risk of skin maceration, and improve patient comfort without negatively affecting pressure redistribution. Each layer of the Skin IQ is treated with antimicrobial agents. Before you finish, we hope you found this demonstration video helpful. If you need more information, please refer to the Instructions for Use manual. If you feel you still require further training, please contact your line manager as soon as possible to discuss. Thank you for your time.